Hey, what's going on, guys? I have a new topic I want to talk about today, and it's I don't know, one that a lot of you are probably pretty familiar with, and it's called derealization. And if you're not familiar with what derealization is, it's I don't know, it's like I guess losing the concept of what you would assume reality would be, and I guess the sensation. And like I said, let's keep sensation on the table here for a minute. That you're no longer in reality and that I don't know, like your everyday processes aren't as normal as they once were. You're not seeing things like they once were, and I don't know, just your overall emotions. Just you just kind of feel detached from what reality actually is. And I actually had a subscriber ask me to do a video about this to potentially shed some light on maybe why this happens or how to I don't know maybe counteract it. So that's what we're gonna do today, and I said so. Let's get started. So derealization, what exactly is it, and what causes it? Well, I mean, there's your typical causes that you can find on any Google site, which are like migraines, tend to start that kind of cycle. Caffeine, closed head injuries, antidepressants, benzos, alcohol withdrawal, drug withdrawal, and those are just, I guess, external. Some self-inflicted, some are just genetics, whatever you end up having. But see, of course, I have my own theory, as I always do. And that's when we're going to go back to this whole sensation thing and the sensation of not being in the present moment anymore or not being in reality with everyone else. And, what exactly causes that? Well, with, being a stress, anxiety, panic, hypochondriac sufferer, um, you tend to get inside your own head and you get lost there from time to time. I mean, like, have you ever been driving and, it's like you're driving, and then all of a sudden it's like bang, you back awake, have no clue that you've been driving for the last, you've been driving for the last half hour, but you really don't have much recollection of being, I guess, present again, while you've been driving. Like you're just like, wow, how did I get here? You start thinking a little crazy. Well, the fact of the matter is you are stuck in your own mind. You're stuck in your own thoughts and what you think is happening to you, whether it, be hypochondriasis. Like, if you're so involved in your symptoms, there's a lot of times where you're very, very stuck in that frame of mind and you have internalized it so much to the point where you are, like I said, stuck in your own head. And when you actually snap out of that for whatever reason, I don't know, maybe at a stoplight or you hear a loud siren, anything that will snap you out of it for a split second, maybe even a phone call, and for a split second up to potentially 5 minutes, you're looking around being like, oh my god, where did this come from? Why am I here? Where is this? Why doesn't this feel real? Well, what it is like I said, it's you snapping back out of being somewhere else. It's almost from going from like dark to light. And what I mean by that is, when you're in the dark or when you first wake up in the morning, you flick on a light, it's just like you're trying to get back, refocus, get your eyes back adjusted to the light. Well, in the same sense, you're trying to get your mind back focused and back to reality because, like I said, you've been spending so much time, inside your own head. Um, Derealization is a funny thing because it typically happens when when your stress level has been so high for so long that you really, I don't know, like your body will tend to, not even your body, your brain will tend to start to shut down some of its processes. And you can read this anywhere, but it's just your brain will start to turn off certain things in order to protect you, because like your stress level is getting to a certain level. Usually it's peaking, and it has been prolonged. So in order to take care of itself, it has to shut down and try to give your body and mind and everything else a chance to get back to where it needs to be, back to center, if for lack of a better term. You know, in derealization symptoms, I know these can vary. They're very case sensitive, I guess. But I would say the most common is when you snap back out of, whatever place you were at, where you were stuck in your own mind, like your vision seems pretty distorted, like sounds seem different, even like typical buildings that you see and landmarks, they just don't seem to really make a whole heck of a lot of sense to you anymore. Like, for a short time. Like you almost kind of wonder if you've ever seen them before, if you've ever, been here before. Like, have you ever asked yourself those questions? You're like, how did I get here? Why does this look so different? And I think it's almost the same basis as like deja vu sometimes. You know, Deja vu is some sort of a phenomenon, a metaphysical thing, if you will, that, people are just like, oh, I'm just reliving something that I've seen in my past life. If you really think about that, it doesn't make a lot of sense, because if you saw what you're seeing now in a previous life, say you're driving through a neighborhood and you're, looking around, you're like, oh my God, I feel like I've been here before. That doesn't make a lot of sense, considering a previous life would probably be close to about 100 years prior, if not more. And those buildings probably weren't there before. And, if we're talking going back, to the 1800s, 1700s, 1600s, you'd probably be seeing dirt roads, a lot of farms. I don't know. There's a lot of things that you would be seeing, but I guarantee you wouldn't be seeing this, you know, new condominium. You wouldn't be seeing, newer cars and, things like that. So I mean, like, really, like, wrap your mind around that for a second. It's like deja vu. It's kind of bullshit, and that's my opinion, and take it for what it is. But I'm not one to jump on that. I really believe that deja vu is really just a mild version of derealization. You know, so you know, moving forward, let's go back to the peaking of the stress. If you're having symptoms of derealization and you feel like you're out of it and that you can't really process things like you normally would, it's time to do present, get back to present. Do, like, mindfulness exercises, like, and I know that they're not necessarily easy, and it's not really easy to do in the car, but I mean, those are really the things that get you back to present, get you back to reality, get you back to feeling good. Because you have to just actually recognize the fact that that you were really kind of stuck in your own head. And I mean, if you think about it hard enough, like, what that feels like. What it's like to be stuck in your own head. Whether you're replaying old memories, old failures. I mean, a lot of different things. I mean, maybe you're so terrified of a certain symptom of you, and you've created your own little movie in your own head about how it may play out. And I mean, if you think really long and hard, or if you actually record and journal, these situations, like when you're having, the derealization, I mean, I think you'll be hard pressed to find anything, metaphysical, anything crazy phenomenon, anything along those lines that's actually going to explain it. It's really the fact that you were stuck in your own head. And again, that is my opinion, but that is also my experience, because I do pay very close attention when I do have these times myself. Like, I mean, derealization really never bothers me too much. Like, I mean, I do have it from time to time where it's like I'll look in, I've had times where it's, I'm feeling so weird, and I'll look into a mirror and I'm just like, what in the blue hell am I looking at? Who is this person? I mean, really asking myself some very irrational questions. And I actually think it's pretty normal. I just think I'm a little bit more vocal about it, and I'm not scared to communicate that. I am who I am, and you are who you are. So, I mean, not fearing it, I think, is step one. Not being afraid of it, and actually understanding the processes that are happening and what's going on with yourself, as to why this could potentially be happening to you. Like, really pay attention to what's going on at work with relationships and everything along those lines, of why your stress would be so high. I mean, like I said, is it fear of an illness? Is it fear of, a potential failure, reliving old failures, anything like that? I mean, I think if you really dive deep into those things, I think you'll really find that you were really just stuck in your own head. And when you're stuck in there for so long, when you snap back to reality, bang, you know what I mean? All of a sudden, everything's just like, oh, you're kind of disoriented, like coming out of a sleep really quick. It's like you not really sure where you're at. I really don't think it's something to be so feared, you know. And like I said, like the things that I was talking about at the beginning, I mean, you may have some of those side effects, those symptoms. It's like maybe your caffeine intake is too high. Maybe you do suffer from migraine headaches. Maybe you are on a benzo. Think about those things. I mean, they are contributing factors. So, I mean, put that on the list. Start to debunk things. Like I said before, getting over these disorders and these little side effects and the little subcategories of this anxiety, like derealization, it's a chess match. It's all about becoming smarter, knowing your enemy, knowing what to do and how to get over it. And, sure, it's scary. It's always going to be scary. But if you learn how to get over it and you start to recognize it, it won't be half as scary. Honestly, I think that, you know, being in unfamiliar territory is scary for anybody. And then, like I said, when you snap out of these things and you're in unfamiliar territory for a split second, it automatically jumps you right into the fight or flight response. So I mean basically, so you got a combination of normal anxiety symptoms caused by fight or flight, and then like I said, snapping back to reality. Trying to process all of that all at once, and it makes it very difficult. Um, Honestly, sure. I mean, we could really dive deep, and if you want me to, I mean, I can get really scientific on this and talk about the different cortexes and lobes and all that kind of stuff, and where your serotonin's going wrong and all that kind of stuff. But, you know, all those things, kind of roll into anxiety and depression and everything. It's like I'm not a brain surgeon, but I mean, it's like I do understand the concepts, I do get them, and I have done a lot of research on them. So, I mean, it's like if you want to, dive deeper into that, I'm more than willing to do so. But I'm trying to simplify it because, I mean, we make our lives so much harder by overthinking and by being in this frame of mind so often. That's like I said, I try to simplify these things. Like we've said 1,000 times, take it for what it is, not worse than it is. And that's what I'm trying to continue to do. It's just take it as you're snapping back. You've been stressed, extremely stressed. You're at your peak of your stress. You can't take the stress anymore, something to that effect. And I think it's just really just an alarm system to take care of yourself. Take care of your body and remove yourself from the situation that's stressing you out so bad. And also using the mindfulness exercises to get yourself back to the present moment. I think those are the keys. You have to do those things. I mean, how badly do you not want to feel this way anymore? I know a lot of these things take a lot of time and effort, and they're, you know, sometimes they almost feel like a pain in the ass, or they're not going to work or whatever. But I mean, you got to practice it. Practice makes perfect, as always. Um, I'm gonna cut it there. Like I said, I know this one's kind of getting a little long as usual. Like I said, 13 minutes is about my par. So again, thank you for watching, and like I said, I hope this helped you. And feel free to throw a comment or a request out there. And like I said, I'll definitely talk to you guys soon.